it became my mission at that point that if we could prevent people who want to prevent disease, then I want to learn all that I can, and I want to help everybody I possibly can to do that. And I realized that it started with food from there. Like that was the first thing I noticed, that food could even be medicine. And so that then took me back to my roots. Like, okay, so don't hate Chinese medicine so much anymore.
Welcome to Personalized by VitaminLab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Dizer. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by VitaminLab. I'm your host, Dr. David Dizer. Today on the show, I spoke with Dr. Tatyana Steele-Hall, Doctor of Traditional Chinese Medicine, acupuncturist, functional medicine practitioner, esthetician, and all-around interesting clinician. Dr. Tatyana's practice revolves around holistic health, with a focus on gut health, pain management, and addressing the root cause of health issues. Her unique approach blends her multicultural background, traditional Chinese and Korean medicine, acupuncture, five-element theory, and evidence-based functional medicine, ensuring a comprehensive approach to patient care. She's on a mission to provide personalized, comprehensive care, recognizing that true wellness encompasses body, mind, and spirit. Enjoy our episode with Dr. Tatyana Steele-Hall. Welcome back to Personalized. I'm here with Dr. Tatyana Steele-Hall. Very nice to meet you, Tatyana. How are you today?
Great. Thank you for having me on the show. Nice to meet you.
It's very nice to meet you as well, and thanks so much for joining us. My understanding is that you're a doctor in TCM. I love talking to people who have expertise in TCM. It's a really, really important part of naturopathic training here in Canada, but we don't really take it on like obviously you have, and your career kind of started with that. So that's the framework by which you have evolved from, but now you're doing so much more and have expanded. Can you tell us a little bit about that journey going from TCM to functional medicine practitioner?
Well, believe it or not, I actually started with complementing alternative medicine. So, aromatherapy and herbs from a complementary alternative medicine. And then the next phase was into traditional Chinese medicine, which was a whole nother medicine in itself, but pretty amazing. It's very holistic. It's very whole person oriented, and I use the five element theory, so it's real easily systematic. And then in treating patients, I wasn't getting the rapid results that I feel TCM should give. And so as I delved deeper into each patient, started to realize different deficiencies and would throw, oh, you look like you could need a B complex. So I'd throw a B complex at them. And then suddenly I started seeing these improvements take place. And so that catapulted me into the world of functional medicine. And I actually now start with functional medicine, but I still use the background of TCM and its philosophies and its whole understanding of people to create my treatments.
Oh, that's a really cool foundation to work from. I like that. Can we talk a little bit more about the connection between the two and how you utilize them? Maybe specifically thinking about it from a systems perspective. A lot of people like to practice using a systems-based approach, but in
Right.
TCM, the systems are a little different than we would think in conventional physiology.
Well, it's interesting. The systems in TCM, if you break it down into five systems, every system has a yin and yang. So
Mm.
there's like the spleen stomach systems. Spleen is actually, I think in Chinese, they didn't realize, but it also includes the pancreas. So it's your spleen, pancreas, and your stomach, which in Western medicine, we would translate that to your digestive system. But there's also a little bit more that goes with it, and it can get very, very complicated. So I'll try not to blow things up to a
Sure.
very,
Yeah.
yeah, complicated situation. But anyway, and then we believe in a chi cycle. So everything starts with the spleen, stomach, which, again, would be the digestive system. And then it moves into the lung and large intestine system. And then from there, the kidney and the bladder, urinary bladder system, and then on to liver, gallbladder, and then on to heart and pericardium. And they all have a relationship, but that's kind of the system that it goes into. The chi cycle is what we call it. And then it's kind of interesting because within each system has certain things. So like for example, if somebody has insomnia, then I know that has something to do with the heart and pericardium system, and it could be that somehow the kidney and the heart are not communicating. So the system makes it easier for us to be able to see a symptom, know what system we're working with, and then what is off, what's not giving it the nourishment it needs within that system. And so that helps us to trace back to the root cause. But of course, in Chinese medicine, we still always start with spleen, stomach. Like that has to be first.
Definitely. But before we get to that, can we go through that example, please? Because I think there's a lot of value there in thinking about insomnia from a TCM perspective. Insomnia can be really hard to treat. It's such a challenge. Tell me about how you approach it.
It is really hard to treat. So the first thing I do is I go backwards. So if somebody's having insomnia, the first thing I start to do is I start to ask about their sleep patterns because, are they having a hard time falling asleep? Are they waking up in the middle of the night? Because that's also going to tell me which system is causing the problem. So hard time falling asleep falls into the liver gallbladder system, which means there's some stress going on. Waking up in the middle of the night means that they're having some kidney deficiencies. So pre birth, you're in the kidney system. After birth, you're in the spleen stomach system. So if it's a kidney system issue, then what feeds the kidney is going to be the lung and large intestine system. So then, okay, are you breathing? Are you smoking? A lot of times I discover that it's somebody that is smoking. So whether it's vaping or cigarettes or
Mhm.
marijuana, I have a lot of younger kids that'll come in and they have a hard time sleeping. And so they started smoking marijuana so they could go to sleep. And I'm like, well, that's a vicious cycle because if you don't allow your lung chi its full capacity, then that's going to start starving your kidney system, which then is going to take it out on your heart system, which is where your insomnia is going to be. So it's
Mhm.
just kind of a trail back of figuring out what is going on.
Yeah, I love that approach. I think that's really cool. It helps you organize your thinking.
They could also be asthmatics. There could be a number of things, but we just end up going backwards and looking for the source of the problem.
Hmm. How do we progress that to something like a treatment? Like let's say for example it's falling asleep is the issue. And so we're thinking about the liver system. How does that evolve into a treatment and what might a treatment look like?
So if it's a liver problem, I mean, if it's a stress problem, liver problem, then, I am going to add some either one of two things. We either need to find out is it the liver is stressed or is it the liver is not getting enough nourishment or is it, too much. So it's kind of like what is going on with the liver. But there are really some wonderful herbs for liver specifically like milk thistle is a good one that's commonly used. We use licorice root along with it. Dandelion's another big one that we'll use. So usually formulas are created to kind of calm the liver system down, and then that helps to allow the person to get some better sleep. But what happens though a lot of times too is that when the liver system is stressed and because the liver system actually controls chi,
Mm.
so it will stop even if you're putting chi in the digestive system, it's not going to allow it to go in the circle that it needs to. So liver becomes really, really important. When I first started practicing, I thought, oh, well, today's modern world is not really, back in the 5,000 years ago when Chinese medicine came about, if there was famine, there was worry about food. And so maybe that's why the medicine started with the spleen and stomach system. But today's modern society, it's all about stress. So let's start with the liver gallbladder system. But I've found in my practice that that might be true, but you still can't start there. You still have to start with the digestive system.
And what does starting with the digestive system look like for you?
So I look for dysbiosis. I look for is the gut off? Is it digesting food properly? Are you having bloating? Are you having acid reflux? I mean, and especially after COVID, unfortunately, and vaccines, the gut's really been destroyed, not to mention, the way that manufacturing of food today is and all the herbicides and pesticides and how such a disruption that has gone into the gut. So with that, most people don't have the healthiest gut regardless. Even if they try, it's still, there's still so many things out there that are affecting that.
Mhm. You start with assessments as well. Like what kind of functional assessments would you use for the digestive tract?
Okay, so the first thing I start with any patient is I do a full set of labs through Quest Diagnostics, serum labs, and then I will do a food sensitivity, which is ALCATS. I like that one. It's got a 3% margin of error, so it does a leukocyte response, so it's not looking at IgG, IgM, it's looking, or it doesn't look at all at IgE. So if somebody's allergic to something, that's not going to benefit you.
Mhm.
But for food sensitivities, it's still a very telling, and it helps me actually create my protocols as well. But it tells them what to eat, what not to eat to get out of an inflammatory state. But also, it tells me like what things I can use that are not going to be counterproductive. And then I run a micronutrient antioxidant assay to find out. The micronutrient gives me a 6 to 9 month view of what nutrients are absorbing and what are they getting a lack of and what aren't. And that in itself can be very telling as well. The other thing that I run is a 5 gene mutation for methylation. So those reports, because you start getting crazy with these functional medicine reports, and unless you have a real reason to run a mycotoxin or Lyme disease or something like that, it's very expensive. So you don't
Mhm.
want to just inundate your patient with a whole bunch of labs. I mean, the ones I run are around 1,000 anyway. So
Mhm.
the insurance will cover the serum, but they don't cover any of the functional ones. So it's already, I try to be mindful of that and see if I can't work from there. And it's usually actually a very good place to start.
Mhm. Can you connect some of the patterns that you may see on these results with
Yeah.
your TCM background a little bit? Well, like, let's say we see someone who's chronically inflamed. How can we explain that using TCM terminology, or is it possible?
Well, no, because I mean, yes and no. I mean, it depends. With TCM, there's heat, there's cold, there's toxic heat. So, inflammation, I look more at the potential of there being heat or toxic heat. But in what system are we talking about? So yeah, it gets a lot more complicated. I have a really hard time explaining it in layman's terms that make it make sense. With my patients, I end up just not using terminology for that and just speak in metaphors so that they, like compare them to a car and help them to understand.
Well, those type of practice tools are so helpful.
They are.
Like I was always taught by instructors of mine to like develop metaphors
Yeah.
so that you can explain things really simply and really quickly, but I
Right.
never did. So I just end up being like ridiculously long-winded and going into the weeds so much, and people are like, what's this guy talking about?" It's so helpful to be succinct and to be clear. And it sounds like you have that down.
Well, the thing was, is in medical school, I tried really hard not to memorize or speak the language of doctors, and that kind of backfired in some ways as well because I've forgotten a lot of it. But while I was in medical school, it was still kind of like, oh, we talked all the medical jargon, but I still was trying not to memorize that. And then when I got out of school, I really practiced not using it. But now that I get around more doctors and more colleagues, I'm kind of like, oh, I guess I should remember some of that stuff so I don't sound like I'm not educated, but it is what it is. I'd rather talk to my patients. So, and as
Mhm.
long as they understand, that's the most important thing to me. I get it here. So
Yeah,
yeah,
exactly. That's what matters.
yeah,
So we've got this assessment, right? We're thinking about this from a holistic point of view, but starting with the gut. And we're thinking about food sensitivity, nutrient panel, including antioxidants, and then maybe a genetic approach, like further personalize what you're
right.
about to do. What's the next step for you? What's the treatment programs like, depending on what you see, of course? How do you approach imbalances?
So, one of the first thing that I do is put them on an anti-inflammatory diet based on their results. And
Mm,
it's nice because those results tell them what they can eat, what they can't eat, what they can only eat once in a while, what they need to eliminate. So that's one of the first things that I send them home with. The second thing is obviously based on their micronutrient assay. I use VitaminLab and I will create a custom supplement for them that is to replete any deficiencies that they have. But within that report, like for example, if I'm seeing that they're not getting enough B vitamins and yet they're a meat eater, that might tell me, especially if it's a B12 or something like that, or iron deficiency, those things will tell me that there is something going on with the gut. Maybe it's H. pylori, maybe it's a genetic thing, or maybe it's just simply they have dysbiosis and their body is not absorbing and breaking it down. So they could be low in stomach acids. Maybe they need HCA or HCl, excuse me. So those are telling from the
Mhm.
micronutrient standpoint, as well as I'll look at the amino acids. And I like to see what amino acids they might not be absorbing as well. If they tend to be kind of low in methionine, I'll automatically be, if I didn't run a genetic profile, before I used to not always run genetic profiles, now I just make it a standard, but that would always trigger me to think, oh, they could have the COMT mutation. And so if that's the case, then they would need to supplement some methionine. We'd also need to make sure they weren't doing too much green tea or quercetin as a supplement. So I would kind of go, some direction would be based on that. But in terms of like, am I seeing dysbiosis? That's actually coming from the serum. So
Mhm.
if they're really low in micronutrients, it could be their diet and in the way that they choose to eat. It doesn't always have to be that something's not functioning with their gut. It doesn't always have to mean dysbiosis. Because I have some people who eat tons of vitamins, and
Yeah.
so their micronutrients come back fine, but then their serum labs say that their gut is in horrible shape.
Mhm. Mhm. What are the serum labs that you're using to assess this?
So I run the normal CBC, CMP, the metabolic panel, the CBC with differential. I run a complete thyroid panel. I don't necessarily always run the hormone panels. I will do a cardio IQ lipid panel.
Mm.
If I suspect anything, I'll do a GGT as well with that.
The reason I ask is I'm interested in your interpretation. How are you determining about dysbiosis from these labs? Well, what are the indications that kind of drive you that way?
So I actually have a spreadsheet that I've created with optimal levels of where everything should be. And I plug the results into that spreadsheet, and then I literally will look at anything that's off or out of range, and then what could be the cause of that. And
Mm.
so when it's dysbiosis, there's only a couple of things that are off. For example, if your eosinophils are elevated beyond the optimal range, then it usually means that you've got some sort of, it's not just a food sensitivity, it could be an allergy, but it usually signals parasites. So, parasites can obviously lead to dysbiosis. The monocytes, if they're elevated, those also tell me there's some dysbiosis going on. The alkaline phosphate, well, that can tell me, maybe there's not enough hydrochloric acid in the stomach. Yeah, it's
Looking at the differential, absolutely, yeah, I totally get it. Love it, love it, love it. So we have this big panel, and now we're thinking about how can we support someone, bring them back to optimal wellness, starting with the digestive tract. And are you integrating this nutrient approach you mentioned about making complex nutrients to support deficiencies? Are you combining that with TCM therapies often, or like looking beyond the gut to sort of treat the cause?
so I've tried it multiple different ways, and the one that I found most successful for me is anti-inflammatory diet, treat the deficiencies, do a gut dysbiosis treatment. So from that outcats, I might find that they don't have an inflammatory response to, say, garlic or golden seal or oregano or even olive leaf or pomegranate, any one of those. And I will use them in a combination. So maybe one day they're taking 3 doses of garlic, and then the next day they're taking 3 doses of either berberine or golden seal, depending on what I'm dealing with, and then the amount of dosage. And they'll do that for 3 weeks. And during that 3 weeks, their diet is extremely strict. We cut out all sugars, we even fruit. I try to very low glycemic fruit. And then we might do 3 cycles of that. So 3 weeks on, a couple weeks off, and then back on that. And then we just kind of evaluate things. What I have actually found is that actually clearing somebody's gut from that and then start to add in some probiotics and restore the gut a little bit, I've found that 75% of their issues get cleared up just from that.
Yeah, that's a really cool approach. That's personalized at its best. I've never considered prescribing antimicrobials after an ALCAT. That's a really cool way of doing it.
Well,
Yeah,
yeah,
seeing what doesn't come up and then just using those as your core treatment. Super supportive and very safe. I
right.
like that.
And it's very effective. Like
Hmm.
before, there's so many supplements out there. It's crazy. And they have a lot of supplements that end up having mixed, they're mixed. And the mixed one might have one or two ingredients in there that are inflammatory. So it feels counterproductive to give somebody something that's inflammatory while you're trying to reduce inflammation.
Hmm.
So yeah. So
Definitely.
I found that's a very fast and it works and everybody's a lot happier.
Absolutely. Do you ever use SIBO tests and stool analysis and H. pylori tests and these type of assessments?
I do. I don't always order them. Usually I have patients that come to me that have gone through treatment with their GI. Their GI has put them on the Refactin, but they, didn't feel like it was completely gone. Even though their test came back negative, they still feel not so great. I mean, I'm not against that particular antibiotic. It's probably the only one that I agree with. But yeah, I'll take them through a deeper systemic cleanse then with that,
Mhm.
using non antibiotics and things like that.
For sure. Can you teach me a little bit about your use of the methylation assessment? I run this one too because people request it from me, and my my interpretation skills are not good. My programming skills following the results are not great. I'd love to hear about your kind of step by step approach to methylation. Well, like, first of all, when would you use a methylation test? I know that you're using it very frequently now. And how are you approaching the results?
So with the methylation test, it's the one that I use actually gives me a really nice interpretation. So I don't have to study. I just read it and it basically lets me know, I mean, you don't just give somebody methylation or, give them methionine when they don't need methionine. If their methylation process is functioning, then it's more of a this is what we need to pay attention to in the future, but it's not something we need to address now. And I also make them aware of their methylation issues because, whether they stay my patient or they don't, people like to go and grab vitamins off the shelf. And if they're in the wrong format, then they're just not doing their body any justice. So it is a teaching tool. It is something that I will use if I see that it needs to be used, but I run it just really for if something's currently going on or, it might just be an educational piece of paper, but it's
Mhm.
worth it.
For sure. Yeah,
Yeah.
I've been thinking about it, the use of it, for example, in chronic anxiety, like unexplained anxiety, chronic stress, difficulty managing stress. I find it valuable in those scenarios.
Absolutely, especially the COMT one. Yeah, COMT is a big one I find that a lot of people that have anxiety also have COMT. And if you look at their dietary, they didn't have a lot of energy, so they were on matcha or green tea and tons of it, which is actually counterproductive to their, it inhibits the COMT enzyme and then they can't make SAMe. And so it's just this vicious cycle. So when you kind of get them off of that hamster wheel, then they can better get the nutrients that they need to kind of get things back on track. But it doesn't stop right away. It takes a minute,
Yeah, definitely.
especially with the B vitamins.
Do you have a very broad practice, or is your practice very narrow focused? Tell me a bit about the types of patients that you see.
So actually, it's not narrow; it's broad. I have cancer patients. I have Parkinson now. I just started with a Parkinson patient. My first coming out of school was he had cervical dystonia. So he ended up being pro bono because I could not figure, he was one of the reasons. He's actually, I would say, the one that catapulted me into functional medicine
Mhm.
because he was fine with the micro improvements that he was getting because he had been suffering for 6 years. But in my mind, I was like, no, I mean, this is clearly liver wind. We should be able to, liver wind is one of the hardest things to get rid of. That's the TCM diagnosis. But still, I just expected much, much greater improvements. And I eventually just was like, you're pro bono until I figure this out.
Wow.
so, so, I mean, and then with each story, you get a little bit more information and it's like, oh, I'm a vegetarian. I was like, okay, but you said you ate eggs and chicken. How often do we really eat eggs and chicken? And it's like, oh, maybe once a month. I really don't like them. Okay, so some of
Mhm.
these things, as you start to peel away the onion, you find out, oh, you need some nutrients.
Yeah, definitely. Are you using any other functional labs in your practice, like hormone assessments, for example?
So at the moment, I'm still using Quest for hormone, but I want to use a saliva hormone testing. I believe Geneva was the company I was looking at for that. They're supposed to be a lot more accurate than the serum. I haven't delved into hormones yet. It's still something I'm very in the early stages of. I seem to be able to correct it if it's not crazy.
Yeah, right.
And actually, I go to Chinese medicine with that first.
Yeah, definitely. Chinese medicine can be so helpful in hormone balance. Can you talk to
Right.
me a little bit about that approach? What that approach might look like?
Yeah. So I will incorporate some acupuncture depending on their symptoms, but the acupuncture I use more towards the symptoms. Are they running heat? Are they running cold? That kind of thing, night sweats, things like that. But I definitely, there's about three different formulas that are my go to formulas in Chinese medicine to treat, like, if they're having the huge menopausal symptoms or are they just having night sweats, depending on the level and the severity of their symptoms, will dictate to me. And no matter what, it's a kidney system, and it's kidney system also is part of the reproductive system. So that's whenever we're looking at reproductive system, we're looking in the kidney system.
VitaminLab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and VitaminLab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
How can we support a patient's lifestyle? Like, what kind of lifestyle advice can we give to support their kidney system?
So kidney system is generally there's a season that's the kidney season. So it's like one of the best times to really bulk up and eat up on the food. But you're looking at black foods, dark blue foods. You're looking at like bone broth, chicken, egg yolk, black beans, blueberries, blackberries. There's even such a thing called black chicken.
Hmm,
But black rice, yeah, I know. That was the thing I thought too, but there actually is a black chicken. So during the winter seasons, you really, really want to nourish those. But also, there's a Chinese yam or sweet potato. It's the one that's got the purple skin on the outside and it's white on the inside.
right.
Those are also very nourishing to kidney. So usually I will recommend a lot of those foods. If we're trying to be weight conscious, then I might not suggest a ton of sweet potatoes, but stay more on the chicken side of things.
For sure.
But
And like, let's take a case, for example, where that's really helpful, by the way, because I never thought about, that's why I asked, because
no.
I never thought about what the lifestyle approach might be. What about in menopause? Say, for example, we're thinking about the kidney system. Someone has just entered into menopause and they have a series of symptoms, including hot flashes and night sweats. You may connect the nutrition with a supplementation protocol. What are the herbs or the herbal combinations that you most frequently would go to in that scenario?
So there's a formula called Luwei Dihuang, and forgive me for
Yeah, the
like,
English names are tough,
well,
aren't they?
I just have a terrible pronunciation when it comes to the Chinese herbs. It's like, yeah, that one. That one it tends to be the first. It's a little bit more of a longevity one, so that one they can be on for quite some time. And it's the initial stages you might want to just do that. You might want to just start, you don't want to like totally blast the kidney system
Mm,
and you just might need to gently nourish it. So we tend to go to that one first. But if somebody's like in full on hot flashes and they're just having a really, really hard time, then I might give them the English word would be menoplease would be the one that the
Please.
formula name that I tend to use. That's actually not the Chinese name, but for me to remember.
Yeah, yeah.
That one tends to grab it. I don't usually like to put anybody on that for longer than 3 months. If we're not seeing some immediate improvements, though, within a week or so, then I usually will try to look at what other things could be going on.
As someone who has basically this kind of dual career going, are you still turning to tongue and pulse diagnosis or using those as tools for assessment?
I do. I don't do that until after I've thoroughly made sure that the gut's doing what it needs to do. So once we've gotten the gut cleansed out, we've done a systemic detoxification, and there's still a little bit of this or that that still needs to get done, then I'm looking at tongue and pulse. But I mean, I shouldn't say that. It depends. It's a case by case.
Mhm.
So the majority of my patients are coming in, they're going through the whole anti-inflammatory the whole systemic detoxification, all of that. But it's like occasionally I'll have some that'll come in and they're just a little bit more like that's a little too dramatic. Don't need to go through all that with them.
Mhm.
And so in that case, yes, tongue and pulse becomes, especially if it's long distance.
Mhm.
Tongue, I can't do pulse, but tongue becomes a something very telling.
Yeah, definitely. I use it in my practice for sort of like the first year or two, but then just slowly kind of got away over time because it was a big part of our training, of course. Really cool. I loved. I had a mentor who was really interested in TCM, and in our clinical experience, we always included that as part of our objective assessment. I thought that was really valuable.
Did it come from traditional Chinese medicine?
Yeah, five element theory.
Oh, okay. Okay, cool.
That's what they teach here at our institution is five element theory.
Oh, nice. Okay. 'Cause I do Korean acupuncture. I mean, I do Chinese acupuncture as well, but I just find that less is more. So
Mm.
I do Korean acupuncture more often than I do Chinese acupuncture. Again, depending on what I'm treating. So, yeah.
I'm not familiar with Korean acupuncture at all. How is it different from Chinese acupuncture?
So Korean acupuncture uses the five element system.
Mm.
So there's 4 points, and you're going to treat in the system, and then you're going to tonify the system that's the problem and the mother to that system. And then you're going to reduce the system and the grandmother to that system. I don't
Okay.
know if you know that part of it.
I don't know the grandmother part of it.
Okay. So so in the chi cycle, each system is both a child, a mother, and a grandmother. So starting with the spleen stomach system, your heart and pericardium would be the mother, and the spleen stomach system would be the child, and then the grandmother would be liver gallbladder. So and then it just kind of goes around like this. So then when your lung and large intestine is the child, then the mother is the spleen stomach, the grandmother is the kidney, and yeah, I
Makes
mean
sense.
is the heart and pericardium system. And so one of the like metaphors or visuals that we like to say is when the child needs nourishment, mom will nourish that child, but when the child needs discipline, then it's grandmother that will do the disciplining. And so that's also very telling in terms of what system's off. So whenever the stomach is off, the digestive system is off, we do look to see what kind of stress levels are causing
Mhm.
that. Because obviously, I mean, even in a Western world, stress will totally change the flora of the gut. So
That's such a cool approach. I love that. I love it.
yeah.
I've been trying to integrate a little bit more of, say, an energetic kind of feel to the practice. We're teaching about lifestyle, for example, teaching about what types of actions would be good, for example, for the adrenals, or what might be good for someone's brain function, whether they need to be doing, say, for example, meditation, or if they need to be doing more intense exercise or less intense exercise. And I'm interested in your take on this, but also how do we explain, for example, the yin and yang of the organ systems in the body, and whether or not and how should we explain how to integrate the differences in the different systems, for example, using that model? How can we explain yin and yang
Okay.
and then connect it to lifestyle prescribing?
Okay. So yin and yang is many things, but first we'll go with the yin and yang organ system. So yin is within and it holds on. Yang is out and nothing stays in. So, for example, spleen, stomach. Your stomach holds on to something, but for not very long. It's got an emptying thing. Whereas the spleen doesn't empty. It goes in, it kills off things, but it's not an emptying. Your lung and your large intestine, it intakes, and I guess it exhales, but it intakes, but your bowels are actually exiting. So, actually, as I say it, it doesn't make as much sense as I understand it. But the idea of yin and yang when it comes to the organ systems is yin is the feminine.
Right.
It's the organ that holds on. And the yang system is the husband, the male, the masculine, and it tends to go out. So yin is within and yang is without. So, like, for example, when somebody has high blood pressure, that's yang rising because it should be contained. Yin and yang should always be in balance. There shouldn't be too much yin, there shouldn't be too much yang. When you don't have enough yin, yang can get out of hand and because it's not being contained. So that's how we also decipher. Now with men are going to tend to be more yang, so they may not have as much yin deficiency. They might have more yang excess or yang deficiency. So that's not, it's a general thought, but it's not a rule, I guess.
Yeah, but that's a really good way of explaining it. So like, let's say someone has high blood pressure. Let's differentiate maybe between someone who's yang excess or yin deficient. This is where I'm going with this. What might be the lifestyle choices that we might suggest for them? And can we connect it back to this? Like, I'm thinking about a person, I've had 2 cases of high blood pressure in the last 2 days. One was a female, one was a male. Maybe they have different presentations of this. And we could explain their different presentations using the yin yang idea. Maybe that would be helpful.
So it's for high blood pressure, being that high blood pressure, there's a couple of things that we look at. Spleen is in control of holding blood within the vessels, right? And spleen is part of the digestive system. So we need to make sure that we're eating and or nourishing that blood vessel not to be constrained, but to be, have the flow that it needs to have. So there is quite a few things involved with high blood pressure. It is very much just a symptom. It is not an actual disease. So you have obviously the intake from the spleen, stomach, and then if you go to the kidney system, which grandmother is, beating up on heart. So you can counteract things too. Even though kidney's not necessarily the grandmother, it would be the culprit of counteracting. It can beat up backwards. It's like the kid can also take it out on grandma. Like, the kid can become abusive to grandma too. I guess that's one way of looking at it.
Yeah, that is okay. That's cool.
Yeah. So there's different patterns that go on. When they go backwards like that, it's really challenging. And it can become kind of one of those things where you get lost in the where's the chicken, where's the egg thing. But again, it's still the kidney rules the pressure in the body with the sodium balance and the mineral balances. And, that plays a role. Also, because it's not nourished and getting what it needs, it will then cause the liver system to not get what it needs. And then there's the stress factor that takes place. And then, of course, that takes it out on the heart system as well. So again, you have to kind of figure out, like, where's the source? Is it stress? Is it diet? Is it both? Is it because of stress they eat bad? But my fix is usually there. And then, of course, some Chinese herbs to help in the process of getting them retrained, getting them on a lifestyle basis. When it's yang rising, that means you do need to incorporate more yin in your life. So if we look at lifestyle, what is yin? So yin is nighttime, yang is daytime. So if you have yang rising, maybe that means at night you need more rest. Maybe you do need to go within and do some meditation. Maybe you do need some more yin activities, would be along those lines. They would be more introspective. They would be more about self.
Helpful. I've been working in weight loss for a while. We basically measure metabolism and at rest and exercise, at rest and during exercise, and make plans. And sometimes we have to tell people to train less intense. have to tell them to do easier work, tell them to sleep a little more, take a little
Right.
more time in order to get the metabolism at rest back up to normal, because people can get depleted. And that's what made me think about maybe explaining it this way. Your energetic balance is tilted in a way that might not be favorable for the plan you have. You're too hungry. You're too tired. You
Right.
can't. We were talking with someone this week who's like training 6 days a week and not experiencing the gains that we're predicting,
Wow.
but they're only sleeping 5 hours a night and maybe not eating in a way that is supportive of the spleen stomach system. And so I fully hear you. I'm totally into it. I love thinking about it like this. I want to shift gears a little bit because we have two sides to the show. We're thinking about personalizing care, and you've done a great job today trying to explain a really difficult system. But one other thing I'm interested in is how you got to where you are, and how we can help practitioners and physicians and integrative medicine doctors find out what is the right career for them, what is the right path to choose to kind of fulfill their life's goal. And so I know you have had a different career before. Can you tell us about your prior career and how that has evolved into where you are now?
Yeah. So, first out of school, high school, I should say, while I was in college, went into office management, accounting, thought I wanted to be a CPA, realized very quickly that wasn't the case. But I did 10 years of that. And then rolled
Quickly.
into, yeah, then I rolled into retail management, was drafted into that, and I thought, oh, love this. This is it. Lots of challenges, never got bored with it. And then I got injured. And I got injured at the same time my dad was diagnosed with stage 4 colon cancer.
Mm.
And so I could no longer be a store manager, retail. So it was a time to shift careers. And at the time, luckily, money really wasn't the issue. So it was, okay, what do I want to do with my life now? And it was like, well, I've always been interested in spa. So let's open up a spa. And while I was doing that, I went to aesthetic school while that was under construction. Meanwhile, my dad he was sick, and they pretty much had said, just make him comfortable. And I thought, no, 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 we're not doing that. So went to Barnes and Noble, sat in the aisle, and literally read every book on natural ways of curing cancer. I'm half Korean, so I was raised very Chinese medicine type of thing, and
Mm-hmm.
actually resented it as a child because everything tasted horrible, and I wanted to have cherry flavored Robitussin, not some
Definitely.
weird concoction that smelled and or deer antler and some alcohol. I mean, it was the crazy stuff.
Yeah, completely.
It worked, but it was still one of the things that I just was envious of other kids who didn't have to go through. um, but interestingly enough, when Western medicine pretty much failed my dad, I decided I was going to do something different. So he got out of chemo, came, and they lived with, I think it was about a year. We lived together. And since I was kind of out of commission, I just started cooking and just preparing dishes based on, I kind of played, I don't know if you ever watched the Food Network show Chopped. But basically it's like they give you a basket and you're kind of like, okay, make a meal out of this basket.
Right.
So I did that. It was like, oh, these are all cancer fighting foods. Like, oh, make some dishes. And I happen to like cooking, so at least it was
Mm.
not a horrific thing for me. So it was fun. And I made different foods for him. Well, in that year, we saw, like, we actually thought he was cured. He had no
Wow.
symptoms, no nothing, and he was vibrant, and we really thought, oh, it's good. So my mom and dad went back off to traveling, and he went to eating bad again, and I didn't know the 5-year rule because I didn't have the medical training that I've got now. And 2 years later it came back, and the second
Mm.
time he decided, I'm not going to fight it. I just want to go. So I
Yeah.
said, okay, you can't really change their mind with that. But what I did realize through that was food made a huge difference,
Yeah.
and it was preventable.
Mm.
So those two things it became my mission at that point that if we could prevent people who want to prevent disease, then I want to learn all that I can, and I want to help everybody I possibly can to do that. And I realized that it started with food from there. Like that was the
Mhm.
first thing I noticed, that food could even be medicine. And so that then took me back to my roots. Like, okay, so don't hate Chinese medicine so much anymore.
Let's
Yeah.
make a
And
career of
then,
it.
yeah, yeah. So I followed my passion, my love
Incredible.
for wanting to help people turned into that. And then it being in the spa environment, and I went to aesthetic school. So doing aesthetics and just touching people and having hands on. And then I started to see that as I was in medical school as well, the different things in their skin and in their face that correlated with health. And I thought, oh, I can actually be predictive of what may take place with you if you don't fix things in the future. So then preventative became my passion. Well, preventative was already
Mhm.
my passion, but I didn't realize how early it truly can be preventative. It's a matter of whether they trust you and believe you.
Hmm.
But yeah, there's such a early road. And then I mean you get some people who are in lifestyles, and I've had friends who are kind of like, I don't want to worry about it until it's a problem. It's like,
Mhm.
okay, that's fine. That's your prerogative. But I don't ever want to see somebody die like that again. So if I can prevent it, I want to do that, including myself.
Absolutely. And then did you open your own practice?
So yeah, so I had a spa opened, and then 2008 happened, and so I went from having a spa to just having my
Yeah.
own practice.
Just having your own practice right there.
Yeah. So, which was fine, and then just treating patients while I was studying. So, my initial consultation involved diet. It was not just about your skin, it was also about, well, you've got issues going on with your skin, but this needs to change in your diet. So, started with that, started incorporating aromatherapy and essential oils and different blends that were applied topically as well as inhalant. And then, yeah, and then I just continued school. So for me, the transition was really
Yeah.
easy to change from, like they were already getting advice to just now it's like, well, now I'm a doctor. So there's even more information.
Yeah, definitely. Oh, what a cool evolution.
Yeah.
That's really fun. So how long have you been practicing now?
So I got my aesthetics license in 2007.
Wow, cool. So here we are, and now you have this clinical operations. And tell me about what it's like being a clinic owner for you as a TCM doctor.
So I feel actually very blessed in the sense that because I already had a practice of mindset people who were thinking about self care and wellness, the transition was really easy. But, not everybody, of course, jumps on board and is like, oh, well,
Mhm.
I've known you as an esthetician for all these long. Like all of a sudden, can't just turn you
Mhm.
into my doctor. So there's, still some of that. And then, of course, there's other hardcore MD followers as well. So
Mhm.
when it comes to like anything serious, I guess. But it was just a lot of referral. So
Yeah.
because, maybe I would help one or two of my clients that transitioned into my patients, then they would share me with their friends or anybody that they had. And so, I mean, before I went into the medical field, I did a lot of advertising. I tried a lot of different advertising methods, and some worked and some didn't. Most of them were costly and didn't work, but it would have never been something I would have done from a medical perspective.
Right.
Like you would never see a Groupon for acupuncture by me on there.
Mhm. Mhm.
Never.
Mhm. Definitely. You've had this opportunity to build relationships. Like that's such a great transition, really,
Right.
because you were doing having relationship building for so long,
Right.
and having that established helps with referrals. Like that's the coolest thing. Like we talk about how many patient contacts that you really need in order for that proper relationship to be developed, and you already had a ton of those done, which is so valuable. Like I'm always trying to see people like 3 times to really try to teach them about my vibe. Like who am I? What am I about? It's hard to do it in one session.
Right.
So, we often talk about like how quickly do you follow up? How quickly or how many times do you need to see a person? And it's totally variable. But
Yeah.
like you had an opportunity to go through a few rounds before you were fully trained. And that probably helped a lot.
Yeah. So one of the things that I noticed with some of my colleagues and fellow classmates, like when we were in clinic at that time, I didn't treat those patients like, oh, I'm just, they're just a number and they're just like
Hmm.
each one I took on as mine. And the entire time I was in clinic, they would book in advance just to make sure that each quarter or each semester they would follow my schedule
Yeah.
because I treated each one as though they were my patient and I wanted to know everything about them and dive in as much as I could and fix them as much as I could. So when I left school, many of them followed me.
Oh, nice.
So I think that it's important developing those relationships, whether you're in school, whatever you're doing, you can develop those relationships.
Yeah. And it's reflected by the work that you put in. Your success really is reflected by that.
Thank you.
Absolutely. On this show, we often ask about, because it's called personalized, but we ask about one thing that's unique about you that most people don't know. Can you share that with us?
You know what's so bad is I thought about that question and I was thinking, I don't think that I'm such an open book. A lot of my patients are, they become almost like family.
Yeah.
And so, there's time that we go over things and then there's times it's just mutual sharing. Like they all know I love to cook and they all know obviously that my job is my marriage. Um, and that I love what I do. I think that probably they don't know that I might be a little bit of an adrenaline junkie. That might be the
Okay.
only thing they don't know.
Yeah, right. Tell us about that. How so?
So I like to, well, I haven't done it in a while, but things like, jump out of airplanes or,
No.
oh yeah, jet ski really fast and do 360s around the whole lake. And I mean, the only thing I haven't done, I guess, is anything to do with snow. If you get me in
Okay.
water, I'm good. So deep sea diving, snorkeling, anything like traveling, I love to do, which they know that, but they don't
Mhm.
necessarily know the adrenaline junkie side of me yet.
Yeah. You're jumping out of a plane to get to the location.
Yeah.
Definitely. Well, that's a good answer. That's a good answer. Absolutely. Well, listen, Tatyana, it's been so great chatting with you. I learned a lot, and I think that people have some tools that they can take back to their practice after listening to this. Where can people connect further with you? Where should we go to reach out or learn more about you?
So my website is still under development, but I am on social media. So I'm on Instagram. I don't really do a whole lot on X, and I'm on Facebook. So
Great.
yeah.
Well, thanks so much for sharing today. I really
Thank
appreciate
you.
you coming on the show and spending some time with us. Thanks so much.
Thank you.
We'll talk again soon.
Thank you. You too. Bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get VitaminLab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.